So Dr. Mike has just put out a podcast featuring Dr. K where they're discussing how valuable Ayurveda is. And I've never seen this topic being debated on US YouTube by American doctors. And I feel I should comment on this as someone from India because I've seen Ayurvedic medicine in practice. I've seen family members and people around me getting treated by it. I myself have taken Ayurvedic medicines and treatments in the past when I wasn't as critical of alternative medicine. And I feel what is missing in this conversation is a discussion of how Ayurveda is practiced on the ground. Today, I'm very critical of Ayurveda and all alternative medicine, and I've made multiple videos on these topics in the past. And I've learned that not only is Ayurveda ineffective, it's actually harmful in the way it's practiced today. And in this video with documents showing how legal regulation of Ayurveda works in India, I'll show you why. I've also spoken to a doctor about what they feel about Ayurveda and public health based on the cases they see on a daily basis. Now, I suspect that if Dr. K ever watches this video, he'll write me off as someone whose mind is already made up, as he did Dr. Mike at one point during the podcast.
I was kind of struck a little bit, and then that's when I realized, I'm not talking to someone who has an open mind. Mm-hmm. I'm talking to someone who has a mind made up.
I'm talking about it from a truth-seeking perspective.
Like Dr. Mike, I'm also just as skeptical, but completely willing to change my mind given some data, some evidence that I haven't taken into account. So to Dr. K and any pro-Ayurveda person watching this video, I want you to not click away from this video and fight that human tendency to not hear a contrasting viewpoint. And I want this video to spark a respectful discussion on some of the points that weren't mentioned on the podcast that can add a lot of value to this discussion. My name's Pranav. You're watching Scienceisdope, not MicroStrategy. My channel name is Scienceisdope. Was hacked recently. I got the channel back, but the name has still not changed back. It's supposed to happen one of these days. But remember, science is dope. Let's begin. This video is brought to you by my supporters on Patreon, Buy Me a Coffee, Nas.io and YouTube. If you wish to support me, you can find the links below. So first things first, this is an extremely nuanced conversation. I highly recommend you watch the original podcast. It's really commendable how two people can navigate a conversation where they disagree with each other without getting confrontational in a very non-offensive way. And I admire Dr. Mike for the amount of healthy skepticism he brings to the table. And I respect Dr. K for being honest. I also have a lot of respect for Dr. K for all the other things he brings with his content, particularly in the area of mental health. But with that said, let's get into this video. Now I'm only gonna comment on the parts of the podcast where they discuss Ayurveda. And since this is a podcast, I won't be able to play the entire thing. I'll only be able to take parts of the video and comment on that. Now while doing that, I'm only gonna make the most fairest interpretation of whatever they're saying, always steel manning their arguments. And if you feel like I've misrepresented what they're saying, then please do say so below. But I think that's gonna be impossible given how detailed this conversation is. Let's get into the podcast.
They had a super cool diagnosis for diabetes.
Okay.
They say, go pee next to an anthill. If the ants drink your urine, then you're diabetic.
This is super cool now when you first hear it, but you won't think that when you realize that a qualitative test like this only gives you a yes or no answer and is in no way telling you how severe the diabetes is, etc., which is what determines the course of treatment and care a patient gets. Now, this may feel like an unfair comparison because I'm comparing methods in medicine from 1,000 years back to modern medical care, but this same attitude is missing in people who advocate for adopting these ancient Ayurvedic methods in today's treatment of patients in other areas. You can't have one without the other. And even today, Ayurveda does not have a quantitative test for diabetes.
What did diabetes mean to them? Because to me, it means checking someone's hemoglobin A1C and seeing it fall in a specific range.
This is a beautifully skeptical question from Dr. Mike, and it highlights exactly what I said. qualitative versus quantitative testing. I've been a part of conversations with doctors from an Ayurvedic background. Those of you who follow me on Twitter or Clubhouse will know. And I've seen that most, if not all, the tests we have in Ayurveda are all qualitative and not quantitative. They can only give you a yes or no answer, basically whether you have the disease or not. They may test things like these, or the color of your eyes and skin for jaundice, or the density of stool by seeing if it floats in water or not. All these aren't comprehensive by any means. Now, I tried finding if there's any qualitative tests in Ayurveda that I don't know of, and I found a few papers which I'll leave down below in the description, and none of them talk about a definitive test that's used anywhere in the diagnosis of a medical condition. And how can that be when they had no ways of measuring volume or concentration? Now, I can't prove that tests like these don't exist. That's like proving a negative. But if you are pro Ayurveda, then you can prove me wrong right now. Just show me quantitative and not qualitative tests used to make a diagnosis in Ayurveda.
In Indian culture, this is how well they understood microbiology. So in Indian culture, we eat with our hands, right? So how did people in India clean themselves after having a bowel movement? They would wash with their hands. So and then this is how well they understood microbiology. You never eat with your left hand. You always eat with your right hand, and you always wash with your left hand.
That's an extraordinary claim to make, right? To conclude that they understood microbiology from the fact that they use different hands for eating and washing themselves. A more reasonable thing is to see this as them trying not to be gross and dirty. Or if you're being really generous, you could say that they probably saw that people don't get sick when they did this, and so that eventually led to them adopting this practice. But it's extremely unreasonable to conclude that they understood microbiology from just this. But I'm starting to understand why Dr. K has such a position.
So I may have a rose-tinted glasses when I look at Eastern medicine. I don't think Eastern medicine is perfect by any means, but
rose-tinted glasses. Another way of saying that you're biased towards Ayurveda. When you're biased, you're more likely to conclude in favor of certain claims with very little, even no evidence in support of it. Now, I must make this point very clear because I'm sure there are people watching who are trying to say that I'm trying to insinuate something about Dr. K. I'm not trying to say that Dr. K is being dishonest here. He's just making extremely liberal conclusions owing to his bias. And he's also giving us a very superficial view of Ayurveda with no specifics at all in his answers.
They had diagnoses that many years ago of cerebral palsy?
absolutely.
How did they describe cerebral palsy 1,000 years ago?
I don't know specific. Let me just think about what examples to use.
I'm not even aware of bacteria, right? Antibiotics don't exist.
I don't know. I think they have certain herbs that have antimicrobial properties. They understand the process of sterilization.
You're welcome to watch the entire podcast. He gives no specifics anywhere in his answers. I'm not sure if it's because he doesn't know or if it's because he's greatly influenced by Ayurvedic practitioners he's interacted with in the past who have biased him in its favor. Now, I'm not saying that you should never be biased. Everyone in the world is biased, and the best thing to do is to be aware of your own bias and be ready to change your mind when you come across convincing evidence. Now, I probably have the opposite bias, but I'm aware of my biases and I make conclusions only based on evidence, not on opinions. And I try to show you this evidence so you can go through it and make up your own mind and not just listen to whatever I have to say.
Was it microbiology or did they just see cause and effect?
I want you to be really appreciative of Dr. Mike here for how skeptical he's being. If it wasn't for him, Dr. K would have definitely gotten away with convincing the average layman that ancient Indians knew microbiology. I'm double appreciative of Dr. Mike because even though I'm being skeptical, I have the luxury of time. This podcast was released 2 weeks ago and I've been able to sit and write a script and think through and choose my words carefully Dr. Mike here is thinking on his feet. I cannot tell you the number of times that someone made extraordinary claims like these, like Dr. K, with no resistance and convinced a lot of people. Just watch any random Indian podcast on Ayurveda. I can assure you, you will never see an ounce of skepticism. See, this is the problem I see in India. People see Ayurveda as their invaluable contribution to the world. They see it as something that's developed in their country by their ancestors, and so everyone is biased in its favor. All Indians are. And because there's no skepticism that Ayurveda faces, these kinds of claims are commonplace all over India. Ayurveda holds the favor of most Indians, and that leads to terrible legal regulations that the government imposes on Ayurveda. I'll talk about that soon in this video, but right now let's get back to what Dr. K said.
Because this is where they also develop something very similar to the theory of humors. So they have like these concepts of elements.
Yeah. This theory of humors is nothing but the Vata, Pitta, Kapha model. The 3 doshas model. And these 3 doshas that the human body is apparently made up of are derived from the 5 elements, which is an ancient idea prevalent in many societies, including India. And even though today we've gone well past this theory, we know what things in the world are made up of. It's not earth, fire, wind, water, etc. But still, this model is like the core of Ayurveda. And you know what the problem is with the 3 doshas model? It has no evidence in support. And it can't be tested. These Vata, Pitta, Kapha are not even tangible things. It can't even be detected, let alone measured. If we ask an Ayurveda practitioner what these are, Vata, Pitta and Kapha, they'll be able to tell you conceptually what they are. But physically, what does it correspond to in the body? Nobody can tell you. If you want to know your body's Vata, Pitta, Kapha ratio, you will have to go to an Ayurvedic practitioner.
But the really interesting thing is that what they basically, I think what they did is notice all kinds of correlations and then developed a heuristic system to explain those correlations.
That's not how science works. If you make a model that can explain things but can't predict specifically what will happen because of this, then the model is untestable and unfalsifiable. And again, if you ask me why I'm using this modern yardstick of science to evaluate something ancient, well, Ayurveda is trying to prove itself today, right? It is trying to compete with the modern medicine of today, right? Why wouldn't I evaluate it with the same yardstick as I do modern medicine?
Now, the really interesting thing is if you look in Ayurvedic medicine, they say that there are 3 dominant elements. There's like the earth element, there is the wind element, and then there's the fire element.
I'm not sure what he's talking about, but I presume it's Vata, Pitta and Kapha, but they're very different from earth, wind and fire. It's a combination of the basic elements that make up Vata, Pitta and Kapha. But I presume he means Vata, Pitta and Kapha when he says earth, wind and fire, because he says that those are the types of bodies that people have.
So if you take this depressive pathophysiology and you stick it in someone who is a predominant earth type, you will end up with a neurovegetative depression. If you stick it in a person who's a wind type, you will end up with an anxious depression. And if you stick it in a fire type, these are like Pokemon, you will end up with a depression with anger attacks.
Here, I think we have to talk about the overarching narrative about Ayurveda that Dr. K is trying to give. There are so many narratives about Ayurveda that try to make it seem greater than it really is. And Dr. K seems to have bought into one. It's that Ayurvedic system of treatment specializes in focused treatment for an individual.
Our system of medicine does not make predictions about individuals. It makes predictions about populations. So Ayurvedic system of medicine is completely different because they don't care about populations, they care about individuals. So then ideally what you would want is not even a randomized controlled trial, you would want trials on an individual, right? Because that's when you produce perfect correlation between your scientific methodology.
Absolutely not.
Explain that to me.
Too much bias when you're treating a single person.
But isn't that what you're looking for? Is you want an amount of bias that is specific to the person.
Dr. K gives us an image of how Ayurveda has this highly specific and nuanced care for the individual. That it's cracked something about individual care that modern medicine hasn't. No, not at all. And I can say that confidently. And you will too once you know exactly what this individualized treatment looks like. In Ayurveda, there is a concept known as Prakriti. You can look this up any way you like, and what it means is nature of the body. Apparently, everyone's body is divided into 7 types based on what dosha is dominant in that body. And sometimes it's a combination of doshas. And so you get these 7 types. And they do not translate to anything tangible in the real world. They're not objective, they're not measurable. They're just conceptual definitions. Like a person with this kind of prakriti will have hair like this, will have teeth like this, and will be thin and tall or fat and short, etc. This kind of reminds me of the somatotype theory that William Sheldon proposed in the 1940s. The 3 body types, endomorph, ectomorph, and mesomorph, which today we know is BS and quackery. None of this is based on any evidence or has any scientific support. It's the same with the idea of Ayurvedic Prakriti. Now, if you say this publicly, like I'm doing right now, you'll be bombarded with studies like these that make conclusions in favor of Ayurveda that seem to go against whatever you're saying, but they're plagued with bad design that makes their conclusions unreliable. I'm sure I'm gonna get such study links after this video goes up. Here's what I'm gonna do and what I suggest you do too when you're faced with these kinds of studies. See if they're published in reputed peer-reviewed journals. Immediately you would have eliminated like a huge majority of studies. But if they are published in a reputed peer-reviewed journal, then look at the conclusion they're making in the study and look at whether that conclusion is warranted by the study design. And that depends on things like sample size, randomization, the mechanism proposed, and whether the study is controlled or not, whether it's controlled well to control for bias, etc. Now, I've done multiple videos where I've analyzed studies before, so I'm not gonna go into detail here.
So Ayurvedic medicine just looks at it from the opposite direction. They kind of say, okay, let's start with an individual and let's understand what works for this person. We are starting at a population level and we are trying to narrow down to personalized medicine. They start at personalized medicine and they sort of extrapolate out to a more general way.
Isn't that flawed by design?
Oh my God, yes it is. Let me tell you why we do studies the way we do them. Bias. I think Dr. K is not using the word bias in the same way Dr. Mike is. The bias I think Dr. Mike is talking about is cognitive bias. For example, why do we do double blinding in studies? It's to prevent the researcher and the patient from knowing if the patient is receiving the medicine or the placebo against which the medicine is being tested. That way, we make sure that whatever biases they may have about the medicine don't affect the outcome, the results of the testing. And the recovery of the patient may be affected by many things, not just the medicine. Even the thought that they may be getting the medicine is enough for recovery sometimes. So to make sure that the medicine is producing the effect that we are seeing, we compare its efficacy against a placebo. We make sure we have many participants to test on to make sure we average out the other factors that affect recovery, and we randomize participants in both groups to make sure factors like age, gender, geographical location, health condition, etc. don't affect the outcome of our testing. This is why we call them double-blind, randomized, controlled trials. And then one fine morning when someone comes and says that let's throw out all these RCTs and let's start testing on the individual, that person doesn't understand the concept of an RCT.
So in the Ayurvedic system of medicine, they think that randomized controlled trials are the antithesis of practicing medicine.
And then if you ask me, hey Pranav, aren't we losing the individuality of medicine? Every person is different and unique, right? Yes, but we have to remember that we are all members of the same species, Homo sapiens. The average variation between you and another individual is 0.1%. If you and another person have pneumonia, the disease will pretty much have the same course in both of you. Or you can take pretty much any other disease. This similarity in pathophysiology is what enables us to study the tests on many patients before developing treatments. Now, I'm not saying there is no individual variation in the course of a disease, but given all this, is that individual variation in the disease so much that we devote an entire system of medicine to focusing on the individuality of a disease? I'd say no. There's much more I can say about this individuality narrative. I've taken Ayurveda treatments in Kerala, which is known for its Ayurveda centers. And the consultation session I had with the practitioner was as generalized as it could get. There was no individualized care or determination of Prakriti that I went through. They just gave me Ayurvedic medications based on my symptoms. Now, I cannot conclude this based on my anecdotal experience, but from what I've seen, individual care is not as huge a component of Ayurveda as it's made out to be. All this makes me think why Dr. K is putting so much emphasis on individual care. And now we come to the other narratives around Ayurveda. All you have to do is go to the Instagram clip of this podcast that Dr. Mike uploaded on his page to see the other narratives about Ayurveda. The most common one you hear is that Ayurveda treats the root of a problem, whereas modern medicine only treats superficial symptoms. All this is a narrative. To anyone claiming this, ask them for a specific example of what they mean. You'll usually just get an anecdotal experience of a person who found relief in Ayurveda, which is the same kind of story you hear in favor of any other alternative form of treatment. But you'll never hear an example where the Ayurvedic practitioner understood the mechanism of the disease and tailor-made an intervention that targets a particular aspect of this mechanism to fight the disease, which is what you think happens in individual care. The same way, when these same people claim that modern medicine, they call it allopathy. I'll talk about the term allopathy soon. That modern medicine treats only superficial symptoms, they're getting it exactly wrong. It's modern medicine that treats the root cause and Ayurveda that treats the symptoms. For example, vaccines. They're not symptomatic treatments. They're literally destroying the root cause of the disease itself, the virus or the bacteria that causes the disease. Take antibiotics, antivirals, antifungals, specialized immunomodulators like monoclonal antibodies. All these target the root cause of a disease condition to bring about the required treatment. Now, I'm not saying that there are no symptomatic treatments in modern medicine. There are steroid inhalers or topical ointments are all symptomatic treatments. But to develop either kind of treatment, one must know the mechanism of the disease or at least test the treatment in a systematic way on many patients before the treatment can be approved. And this also is what helps in standardization, something that's missing in Ayurveda. There's more. I also often hear that Ayurveda is also preventive general health and lifestyle advice, and I'm only talking about the treatment aspect of it. Let's look at the common health advice from Ayurveda that one hears. Food should be eaten fresh. Food shouldn't be refrigerated or microwaved. This comes from the idea that food contains prana, a kind of life energy that depletes over time. So when you store food for a long time in a fridge, that depletes prana apparently. Again, none of this idea is based in any evidence. It's not grounded in reality. It's pure BS. Refrigerating and microwaving are safe within reasonable limits. Food combinations. According to Ayurveda, certain foods cannot go well together. For example, fish and milk products. I remember my mom telling me when I was a child to never eat fish and curd rice. Again, there's absolutely no evidence for this. Hot and cold foods. According to Ayurveda, there's an elemental nature that every single food item has. And according to this, some are regarded as hot foods and some as cold foods. And this apparently has nothing to do with their temperature. Their hot or cold nature makes them bad food combinations with certain other foods and makes them give rise to diseases in the body when consumed. Again, you might have noticed a pattern here. This is not based in any evidence. or grounded in reality. Foods are not hot or cold independent of their temperature. When I hear people giving out Ayurvedic health advice, they always have to preface whatever they're saying with the phrase, according to Ayurveda. That's just another way of saying, if you believe Ayurveda is true, then XYZ. It's a phrase that if I hear, I can bet there's some misinformation coming. It's like, according to Ayurveda, misinformation of choice. There are many more such narratives. I'll cover one more about research in Ayurveda in the section about research. But if you can think of more such narratives, let me know in the comments below. You can read the comments below, and I'm sure you'll find a lot of comments by anti-science folk who are against modern medicine and the pharma industry, who will criticize me for not pointing out similar things wrong with modern medicine. And I agree, and I will grant that there are things wrong with modern medicine. To a lot of people, it's just not accessible, and to even more, it's not affordable. And there are many who have faced severe financial losses because of hospitals, and they kind of hate modern medicine because of that. And I see that many of the people who go for alternative medicine, many of its apologists, are such people disillusioned by modern medicine. What they must realize is that the solutions to the flaws of modern medicine do not lie in alternative medicine. It's government regulations of hospitals and doctors and the pharma industry. Better laws that help people not get exploited. Better subsidized care and better funding to make medicine available to those who can't access it. We also need better medical training and better research and more qualified doctors per capita. The only thing you're achieving by going for alternative medicine instead is receiving less effective medical care. You get something like cancer or maybe an infection which doesn't go away on its own, you will inevitably end up seeking modern medicine. And you know what else you will seek modern medical help for? Injury and harm following the use of alternative medicines, which is becoming more and more prevalent in many places all over the country. And this is seen because of the increase in use of alternative medicine throughout the country, particularly the use of Ayurveda. I'll talk about this in more detail in a later section of the video. I've even spoken to a doctor about this. Right now, let's get back to the podcast. Now, I also have to give Dr. K credit where it's due, because he also highlights some of the downsides of Ayurveda.
The good thing about allopathic medicine is that, at least in the United States, if you finish a medicine program, there are standards that people can expect. The first fundamental weakness of Ayurvedic medicine is that you have no way to gauge practitioner reliability. So there were a bunch of like Eastern medical practitioners there, and they kind of asked this question. They said, like, what do you think needs to happen for Eastern medicine to be more widely accepted? Mm-hmm. And my mentor, brilliant guy named John Denninger, said, you guys need to let your treatments fail. Mm-hmm. The problem is there's such a pissing contest between Western medicine and Eastern medical practitioners that no one on the East is willing to say, yeah, this treatment sucks.
The last point especially was really well put by Dr. K. I often go through many studies on Ayurveda because I'm constantly looking for positive results in favor of Ayurveda that come from robust, well-designed studies. I'm constantly giving Ayurveda the benefit of doubt because I publicly don't want to say anything that I'm not sure about. And I can confidently say that over the years, I've not seen any study from Ayurveda that has made me go, hey, this study, there is some serious potential here. And the reason for that is that most studies are unreliable because it usually has really bad design. And as a result, there are no clinical outcomes to actually treat patients. Most studies don't get published in reputed peer-reviewed journals because such bad design can never get past peer review. And like Dr. K said, I think this is because the Ayurveda researchers who conduct the study design it in such a way that it always yields a positive result. What's the point of doing a study then? In many parts of the podcast, they both agreed that 90% of Ayurveda is probably crap. And then Dr. Mike asks this beautiful question.
Why not take what works of Ayurvedic medicine, the art aspect of it, and bring it to Western medicine, as opposed to bringing Western medicine and trying to fix something that is really very problematic, already so far gone?
This is a well-phrased question because I think of the example of artemisinin, a drug that was developed from traditional Chinese medicine that, as an intervention for malaria, was so effective that it won the Nobel Prize. And today, even when it's used as an intervention in modern medicine, nobody will deny that its roots are from traditional Chinese medicine. But there is no such clinical intervention that comes from Ayurveda. We'll talk about this again in more detail in the section Research in Ayurveda. But another reason why I think Ayurvedic practitioners will never agree with distilling Ayurveda down to what works and use that as a clinical intervention, like Dr. Mike said, is because we then have to throw out the Vata Pitta Kapha model, because this is not based on any evidence. And this is like the core identity of Ayurveda, and the practitioners want acceptance for Ayurveda the way it is now, not for the parts of Ayurveda that may work. And that will never happen. I unfortunately cannot include all my points of criticism in this video because it's getting way too long. So what I've decided to do is include a companion video along with this one, which will be available as an exclusive to my Patreon and YouTube members. And in it, I will comment on the parts that I couldn't include in this video, and I will examine the talking points in those parts of the podcast. And that will only be available to people in the connoisseur tier and above. What I will now comment on here is Dr. K's use of the term allopathy.
Allopathic medicine, allopathic medicine, allopathic medicine.
This is such a common term among alternative medicine apologists, especially in India, that I've started using it as a red flag to spot them. I've almost never seen a modern medicine doctor refer to their own profession as allopathy. Where I have seen it though is when apologists or alternative medicine peddlers refer to modern medicine. They use the term allopathy. It's like they haven't gotten the memo yet that says, hey, allopathy refers to something completely different. Allopathy refers to the medicine of medieval Europe. The term was coined by Samuel Hahnemann, the inventor of homeopathy, to refer to the medicine he saw around him in the 1700s. They drilled holes in people's skulls to treat mental health disorders. They would cut the veins of people and let them bleed out to cure infections because they thought the disease was because of bad blood. And they would induce vomiting in people because they thought that would treat digestive problems. That kind of medicine does not exist anymore. Allopathy does not exist anymore. But I still see this term going around in apologist circles. The same circles that I'm sure Dr. K hangs around, Ayurveda apologists, that is. I'm not surprised to see him using the term and using the same talking points that I've seen Ayurveda apologists use before. But these apologists are not the first problem you'll find when you look at how alternative medicine, especially Ayurveda, has taken a foothold in India. I feel that having only looked at what Dr. K has said about Ayurveda gives you only a partial picture of Ayurveda. And it makes it seem harmless, which is far from the case. In India, the law that regulates Ayurveda is the Drugs and Cosmetics Act 1940 and the Rules 1945. You can find this on the government's main alternative medicine portal, which I'll link down below. Now, I put the word regulates in quotes because what these laws actually do is protect Ayurvedic drugs and supplements from undergoing the same level of scrutiny that modern medicine drugs do. Check this out. I'll leave a link to the legal document below, which says that safety study for Ayurveda and other alternative medicine drugs are not required. I've done a more detailed analysis of the legal stuff over on this video, and you can check it out if you like. But what I'll say here is that what this allows for is Ayurvedic medicines, drugs and supplements can get on the market and reach customers without any safety testing. I guess this made sense when Ayurveda mainly consisted of traditional, regional and locally sourced medicines made by small tiny manufacturers who didn't have the kind of logistics to do large-scale studies. But today what we have are these huge multi-billion-dollar brands taking advantage of these laws and increasing their profits at the cost of public health. I spoke to Dr. Anurag Lavekar, who is a gastroenterologist and hepatologist who often sees cases of alternative medicine induced liver injury daily in his practice. Thank you, doctor, for taking time out to speak with me.
Thank you very much.
First, I want to ask you, what's your specialization?
I have specialized in gastroenterology and hepatology.
Which city do you work in?
I'm working in Bangalore.
In your line of work, do you see alternative medicine related toxicity?
Yes, it's quite oftenly we are seeing complementary and alternate medicine is an important cause of
Okay.
drugs-induced liver injury. Patients often come with complaints and diagnosis of acute and chronic liver failure and drugs-induced hepatitis to us.
And how often do you see a new case?
Roughly, it comes around once in 10 days, 2 to 3 cases a month.
Okay,
2 cases a month we are seeing.
Okay. And how often are these cases Ayurveda related liver injury?
25 to 40% of our cases are because of complementary and alternate medicines.
Is it Ayurveda?
Yes.
And what's your opinion on patients having access to Ayurveda drugs and supplements readily in the market itself?
No, actually, it is an important cause of concern. It should not happen. Patient directly goes to the pharmacy and it is available over the counter readily. Many a times it so happens that patient does not know what does it contains. Labeling of those medicines is faulty. Many a times when patient comes to us with a bottle of what he has taken, the bottle is not labeled properly. So what it contains, we don't know. We are not aware of what we are treating. Inadequate labeling is also an important concern. So all these are important problems as far as treatment is concerned. That also poses problems for treating gastroenterologist and hepatologist from prognostic point of view. We cannot tell patients and their attenders how the prognosis is going to be. So it is a problematic thing. So that should not be readily available over the counter in the market. The standard dosing is also not routinely practiced among physicians. So patient tends to take whatever amount of medicines as per his own discretion. So that is also a cause of problem.
Things are even worse in government-run hospitals. Let's see how. Since the current ruling party came to power in the government in 2014, there has been an endless promotion of religion, culture, and history, often at the expense of rationality, science, and critical thinking. An entire ministry has been created to promote traditional medicines all over the country. The A in AYUSH stands for Ayurveda. You can watch this video, which I've linked down below, where I've gone into detail on this. Now, at a glance, this doesn't look like a bad thing, but instead of promote traditional medicine, its goal has become to promote traditional medicine at any cost, and that cost has recently become public health. Also, the AYUSH Ministry does two other things that are completely deplorable. The first is research. If you look at its research portal, you see a lot of studies. That's the least you can expect, of course, given that the AYUSH Ministry gets 30 billion rupees almost every financial year. But let's come back to this research portal. If you look closely, most, if not all, studies here are plagued with bad design and unreliable conclusions. It's almost as if they either try to show a positive result or design the study so poorly so as to get that positive result, even if that means the conclusion is now unreliable because of the poor design. As a result, these studies never pass the peer review to get published in a reputed journal. All they are good for is to show people that research is going on. Now, another narrative about Ayurveda that you'll often hear is that the research has not been done in this area yet. Research is being done. It's just that none of the studies make any conclusions that are, that translate into a clinical outcome. The second is that they manually try to insert themselves into patient care in modern medicine hospitals. Most, if not all, government hospitals now have an AYUSH department, and here's what it does. Recently, I was in Namans, a government-run hospital in Bangalore, for a consultation. And at the end of my consultation, I was asked to go to an Ayurveda and yoga specialist in the department of AYUSH. And every single patient who gets a consultation there goes through this step mandatorily to complete their consultation. Now, maybe this step doesn't cause any harm in and of itself, but this is basically trying to artificially build legitimacy for alternative medicine in the eyes of a patient who might not know any better. But this is not the only way that alternative medicine tries to insert itself into regular medicine. In India, unlike most other countries, you can earn degrees in pseudoscience. You have your astrology and Vastu Shastra degrees and the like, of course. You also have 5-year courses to waste the youth of students by taking degrees in all sorts of alternative medicine. There are degrees in Ayurveda, homeopathy, Siddha, Unani, you name it. And guess how admission is taken into these courses? Through the same entrance exam used for regular medical university admissions. After writing these exams, the highest ranking students go to regular medical universities and colleges, and the lower ranking students, instead of preparing and taking the test again next year, take a seat in a college offering a degree in one of these alternative medicine courses, fearing wasting another precious year of their lives if they don't get admitted as soon as possible. And who can blame them, judging by the legitimacy that alternative medicine is given in this country? Often artificially, they see it as a legitimate career. And now this entrance exam becomes another way of artificially inflating its legitimacy. Most students who get enrolled in these courses have never even come across the notion that what they're studying is a pseudoscience. I know because I've spoken to someone who has gotten such a degree. I want to highlight the irony of the fact that students have to study science and answer science questions in an entrance exam to enroll in a pseudoscience course. I could make a whole other video on what they learn in this course. Let me know below if you want to see that video. But for now, I will end this video here with just one last section. What I do find redeemable in Ayurveda is the possibility of finding drugs and drug molecules from herbs that have been used in Ayurveda. There are already a few that show promise in trials, but there are no such drugs today that are used in any clinical intervention. But what this takes is honest research. Emphasis on the word honest. Because there is lots of research that's going on in Ayurveda, but none with conclusions that are clinically useful. And I'm starting to think that maybe by design, as I've shown you before. The thing is that Ayurveda has enormous sentimental value for a lot of Indians. Like I said, they see it as India's contribution to the world. And that means they trust it immensely, often forgetting the importance of clinical evidence. But we have to ask ourselves, is this sentimental value enough to overlook factors such as safety, efficacy, etc.? Are we willing to compromise public health in the name of tradition? Are we willing to sacrifice reason and rationality in the name of culture? As for the theory of Ayurveda, I think it's complete pseudoscience and BS, and I've shown you why. The world of science accepting something from Ayurveda and Ayurveda preserving its core identity are two mutually exclusive things. I think the practitioners of Ayurveda have to be prepared to let go of the theory of Ayurveda or forever be confined to the domain of alternative medicines and depend on misinformed customers for profits and legal protection in the guise of regulations. If you like my content, it'd be really awesome if you could support me because that becomes my main source of income. You can give me a one-time support using one of these options or give me continued support using one of these options for which you will get perks that you see on your screen. One of those perks is a private WhatsApp group that you get to join where we do stuff like this. One of our members is an astronomer, and so we have amateur astronomy sessions over Zoom call. So if you're interested in things like that, do join. I want to thank my highest tier supporters on Patreon and YouTube. If you support me in my highest tiers, you can get your name displayed on the video like this. As I've said before, I've made a companion video to this one, which you can get access to by supporting me either on Patreon or on YouTube memberships in the connoisseur tier or above. I analyze the talking points, the logical fallacies, and the cognitive biases that are there in the podcast. I'll see you in the next one. Till then, remember to stay rational.